Okay, so let's get started. The first question we'll ask is, what is autism spectrum disorder? So autism spectrum disorder is actually a collection of brain disorders placed on a spectrum due to their wide variety of symptoms, strengths, and levels of impairment. Because of this, some children that fall within the spectrum are actually highly functional, while others are not so much. What comprises the spectrum? Well, under the DSM-4 text revision, there are 5 disorders that are actually listed under the spectrum. They are autistic disorder, Asperger's syndrome, pervasive developmental disorder, also abbreviated as a PDD-NOS, Rett's disorder, and childhood disintegrative disorder, which is abbreviated CDD. The common symptoms of ASD, and I'm going to abbreviate autism spectrum disorder as ASD just for the sake of not having to say it each time. So the common symptoms are as follows. It is important to remember that these symptoms vary in severity from child to child. The first class of symptoms is social impairments. Children with ASD have trouble with everyday social interactions. They make little eye contact. They are less likely to listen or respond to others. They do not share their things and respond differently to the emotions of others. Although some of the causes of this behavior will be explained later, empirical data show that our children suffering from ASD are less likely to focus on social cues that are important for understanding emotion. The eyes, body posture, and overall facial expression are some of the examples of these. Instead, they are actually more likely to focus on one aspect of the face. They also tend to miss other cues that provide valuable social information, such as smiles, tone of voice, all of these things. On the other hand, children with ASD do not display the cues that children typically display when expressing emotion. Instead, their tones of voice and bodily postures lack emotions and can be considered flat or dull. Interestingly, children with ASD have a hard time understanding what other people's attitudes, emotion, and interests are. The reasons for this we'll get to later. Children with ASD are very egocentric in this manner. We don't mean this in a negative way. Egocentrism just means that they have an inability to see others' points of views. This cognitive ability that most children with ASD lack is called theory of mind. And again, this will be discussed later on in the presentation. The second class of symptoms are the fact that children with ASD are not very good communicators. So communication skills is the second class. Compared with most children in their first year of life, children with ASD may be slow to respond to their name, may be slow to develop communicative gestures such as pointing, and are likely to coo and babble in their first year of life, but cease to make any type of noise after that. They also develop language at a slower pace, speak in single words, repeat certain phrases, and use words out of typical context. Children with Asperger's have been known to talk about one thing continuously despite any social cues that other people may be giving them, that are telling them that they are uninterested or need to leave the conversation. Children with ASD will often scream or grab to get their needs met without any professional intervention. So it's clear that children with ASD have trouble with communication. Children with ASD usually display repetitive and stereotypical behaviors as well. Going on to the third class of symptoms here. They often show intense interest in a few things. These things can be moving objects or other stimuli. They may also be preoccupied with certain things that may seem boring or irrelevant to a non-autistic child. Things like this are lighthouses, bus schedules, vacuums. Children with ASD are big fans of routine and predictability. They have spontaneity and randomness. They hate spontaneity and randomness. For example, they may want to eat the same meal every day. And going on to this, I actually have a personal experience. When I was growing up, one of my good friend's brother still is autistic, and he used to watch. We'd go over to his house and we'd hang out, and I remember going over and seeing him literally replay the same scene in a Disney movie over and over again, is the same thing. And of course, at that time, I didn't understand what was going on and why he did that. But now it's a common trait among autistic children, and there's a reason why they do that, which we will get to later. So change in routine can be very upsetting to a child with ASD, and that's important to note for anyone who works with them. Issues associated with... Oh, I'm sorry, that's the next slide. Go on to the next slide.